our children in any city should not be subjected to toxins in their home. The senator's bill will guarantee that our nation's affordable housing has the highest lead standards in order to keep families safe. As we continue to build Jersey City at a record pace, we've been aggressive in building affordable housing units across the city, the first to be built in over 3 decades of 80-20 projects. And to that end, we're also taking steps to ensure the highest lead standards here in Jersey City. Under our administration, lead testing through our Department of Health and Human Services has increased from 103 in the calendar year 2014 to 3,351 in 2015. Lead testing and education by our staff has increased by 815% in just 1 year. There were 53 different education presentations with our testing done and 139 education presentations with lead testing completed in 2015. So it is a significant outreach component of our office. We've engaged 37 additional registered nurses studying for their BSN from NJCU to assist in our enhanced lead testing initiative. Finally, the senator has been a pioneer on so many quality of life issues during his tenure, from expanding funding for health centers across New Jersey and in pushing to remove high-powered magnets from toys to protect children, and this is just another step in that direction.
Communities across New Jersey continue to struggle with lead exposure and lead poisoning due to outdated standards and limited funding resources. And yet the state has repeatedly diverted funds away from lead abatement projects and relocation for families whose children have high levels of lead in their blood. Over the last 16 years, 225,000 children in this state have been afflicted by lead. That's almost as many people as those who live in Jersey City, and more than 3 times the number of people who fit in MetLife Stadium. And in 2015, a year that boasts tremendous scientific breakthroughs, including the discovery of underground glaciers on Mars and a newly identified human ancestor in South Africa, sadly, in that same year, New Jersey witnessed more than 3,000 new cases of children under the age of 6 with elevated levels of lead in their blood. So, as a parent myself, I understand that this is an issue involving the health of our children and their ability to realize their full potential, unimpeded by conditions outside of their parents' control. We know without a shadow of a doubt that lead exposure and poisoning can fundamentally alter the course of a child's life. Exposure to lead can impact everything from attention and fine motor coordination to delays in cognitive development to adverse effects in the central nervous system, and in the worst cases, it can end a child's life. And let's be clear, children with even low levels of lead in their blood, importantly levels which do not currently necessitate intervention under current HUD regulations, remain vulnerable to decreased intelligence and neurobehavioral development, frequently requiring enhanced special education services and additional medical care. We also know that lead can accumulate over time in a child's body, so that exposure to small amounts over time can mean a long-term accumulation. And while we've seen some progress in declining lead poisoning rates since the enactment of federal lead policies in the 1990s, lead poisoning risks continue to disproportionately impact minority children. And one area where the federal government can clearly make a difference is public and Section 8 housing. We need better standards for the children that live in federally assisted housing, which brings me to why we are here today. The U.S. Department of Housing and Urban Development's outdated and ineffective lead standards and regulations are no longer consistent with the prevailing science. In 2012, the Centers for Disease Control and Prevention issued guidance that cut in half the amount of lead in a child's blood needed for a public health intervention. The Department of Housing and Urban Development, however, has not updated its regulations since 1999. So, under current HUD regulations, intervention to reduce lead hazards in a home is not required until the amount of lead in a child's blood is 4 times as high as the Center for Disease Control standard. At this level, a child under 6 years of age may be vulnerable to severe physical and mental impairments. So while many public and affordable housing units, such as the ones behind me, are lead safe, the threat remains that high levels of lead in children's blood will be left unaddressed by our current standards for federally assisted housing. To address this issue, last week I introduced the Lead Safe Housing for Kids Act of 2016. My bill, which has been endorsed by the leading national healthy housing organizations, would ensure lead-safe, affordable housing by reducing the threat of lead exposure and lead poisoning of children living in federally assisted housing. Specifically, my bill mandates that HUD align its definition of lead poisoning with the lowest lead levels specified by the Center for Disease Control. In addition, my bill will require the Environmental Protection Agency and HUD to update outdated standards regarding the amount of lead allowed in dust and soil, 2 major sources of lead exposure for young children. Furthermore, we need to ensure that HUD regulations actually prevent lead hazards before a child is exposed to lead or poisoned by lead in the home. So my bill will also require HUD to act on 2 key priorities for lead prevention. First, it would require an initial risk assessment for low-income housing constructed prior to 1978 for lead-based hazards before a family with a child under 6 moves in. And second, it would provide a process that allows families to relocate on an emergency basis if a lead hazard is found to be in their home. And the bill authorizes funding to make these important changes and promote critical prevention measures. This is more than just common sense. This is about protecting our most precious resource, our children, from risks that are squarely within our control to remedy. So let's take a stand and do everything we can with our power to protect our children. We hear universally that our children are the very essence of the greatest resource we have, and we need to protect and nurture it. Well, this is something squarely within our control to do. And the federal government needs to lead the way by having the appropriate standards and enforcing those standards in the housing that is federally provided or federally subsidized.
It is unbelievable to me that in 2016 we are still talking about this issue. I personally have worked on this issue for 20 years, and the folks that you're going to hear from have been working on this even longer. We live in one of the greatest states in one of the greatest countries in the world. We should be able to solve this problem. It is an entirely preventable childhood health crisis. All we have to do is put the resources that are necessary to be able to solve the problem.
In the last 6 years of this governor, that money has been stolen away and not used for this process. So while this governor may say that we are over-dramatizing the problem of lead, I would say that we're raising the issue, and by Senator Menendez's bill, we're actually dealing with the issue in a very, very positive way.
Well, first of all, let's understand something. There are no safe levels for lead. And the reason I very confidently can say that is that the tests that we have to test for each system, nervous system, kidney system, blood system, are woefully inadequate to determine when something is potentially reversible.
The fact that there's 3,000 new children in 2015 that were identified with a lead level of 5 or above, and there hasn't been a sense of alarm about it, shows that we become complacent. And if there's one thing that is helpful about the Flint situation is that we have new attention to this very, very old problem. And I'm very glad to be here today to talk about, to commend Senator Menendez for the bill that he's put forward. We are finally saying that federal lead regulations must be in accordance to the best science about lead poisoning that is available. A CDC lead advisory committee reviewed current research on lead poisoning and determined that 5 micrograms per deciliter is the level at which intervention should begin, and HUD has been stuck at 20 since about 1992. The most important sections of the bill are those that will help prevent lead poisoning. Prevention is where we want to be, not only at intervention after a child has an elevated level. It is common sense that the federal government should require that a home be lead safe before allowing a child to live in public housing or before subsidizing the rent of a landlord under the Section 8 program. And it calls attention to the fact that a visual inspection is not enough when we call for inspections. Those of us who work in housing in New Jersey cities understand that a glance is not enough to know if lead hazards are present. We need to use dust sampling or X-ray efflorescence machines to really know what is going on in a house. Allowing a child to live in a hazardous unit when we know how to test a unit and can require landlords to make them lead safe is an egregious failure of public policy. Lead poisoning does nothing less than rob a child of their potential in life. We should be doing everything we know to prevent this from happening.